public health partners, our hospital partners, as well as our coroner system, and those that fill out death certificates in the community and hospital sector. At present, though, we're confident that the deaths are being documented as probably a combination of causative and associated deaths within our systems. In our retrospective review, I think will give us better assurance on the level of quality. So I would thank you for the question. We're working on this, but I don't have an immediate answer, given that this is going to be a journey of improving a very important data element in our suite of information that I think is important and relevant to Ontarians. So we addressed hospitalization and now have good information on causative admissions versus associated admissions, both to the general hospital wards as well as to the intensive care unit. And we're committed to providing that same level of improved data for death certificates.
Follow-up. Is that the largest outstanding question with the death data, though, whether people are dying because of COVID or with COVID? You had said, I think last week, that it seemed like a large number of the deaths were still due to Delta because of, I guess, the lagging time of infection. Do you still see that as the case? Have you been able to see the data on that, to see whether it's just the volumes of Omicron that's causing these high numbers, or whether Delta is truly behind some of this?
Well, a very interesting question again. So what we've learned through our Public Health Ontario partners who know of the incidence of Delta versus Omicron, they've told us that the vast majority of outbreaks in the community are absolutely Omicron, 99.9%. But in hospitals, given the severity associated with Delta, that their whole genome sequencing is telling us around 10% of admissions in the hospital are still relevant to Delta. And the whole genome sequencing data takes weeks to get back. So we'd have to correlate that with the death certificate to ascertain whether it was Delta and or Omicron. We absolutely agree that a significant proportion of the deaths in January would have been because death is a delayed signal from an outbreak, given that we've got access to healthcare and an ability to try to protect people through hospitalization and intensive care unit settings. In the first several weeks of January, we're confident that a significant proportion of them were from Delta, but now we need to tie them also with whole genome sequencing data.
Next question.
Your next question comes from Matthew Bingley with Global News. Please go ahead.
Hi, Doctor. You pointed to the number of hospitalizations that are still on a rise, even though it is a slower one. But in the directives today, we're seeing that contact tracing will no longer be required for businesses next week. And I'm just wondering, at a time where you're saying there is still a need for constant vigilance and protection, and when we see, testing is still under a threat, why you would be removing this from the directives?
Well, thank you, Matthew. Our key goal with public health right now is to protect the most vulnerable sectors. I think we can assume that given Omicron's transmissibility, there is an ongoing risk in our communities. And we must individually try to reduce our risk over time by taking all the appropriate measures, getting vaccinated, wearing a mask, distancing, good hand hygiene, monitoring for symptoms, and those will keep us well protected. Our public health agencies now are trying their best to work with our long-term care partners, those that are in shelters, those high-risk congregate settings where they're trying to protect those patients and populations through outbreak management and case and contact management in those high-risk settings. The amount of virus in the community is not such that individual case and contact management will have any benefit. I think on an individual level, you have to identify your risks. You have to monitor your symptoms on a daily basis. If you've got symptoms of COVID-19, we've got instructions on ontario.ca of how to monitor and care for yourself. and when to seek healthcare and when to get access to the RATs, which I'm happy to say we'll have greater access in the coming weeks, given that the federal government is starting to ship more and more RATs to us so that you can have testing done in the comfort of your apartment or home and not have to go elsewhere for it. So I hope that the Ontarians understand that we're trying to prioritize our case and contact management capacity for the highest risk and most vulnerable populations.
Follow up.
Global News has been reporting for 2 weeks on doctors spreading misinformation in Ontario, and now one has launched a service prescribing ivermectin to treat the virus. The Ministry of Health has so far refused to answer questions to us on this, and I'm wondering what concerns you have over or really what the point is of license restrictions if there are loopholes such as this that can be exploited, and what concerns you might have over a refusal to help the CPSO help out the public with this increasing risk.
Well, thank you for that question. So the Science Table has a document on their website that outlines what therapies have good science to support them and what don't. And on their recommended against list, where the following therapies are not recommended for the treatment of COVID-19 due to the lack of benefit, potential harm, and system implications of overuse, they include ivermectin in that list. They're the experts on therapeutics and have done the research and science on them. So I would hope that the College of Physicians and Surgeons would recognize if a science body says they should not be used, that physician's practice would be reviewed and an appropriate review of their practice and discipline would be put in play. It's a question perhaps best for the college themselves, but the Science Table has confirmed that ivermectin is not a medication that should be offered for the treatment of COVID-19 in Ontario.
Next question.
Your next question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Doctor. I just wanted to get at the vaccine passport situation. You were saying earlier how important it is to get a booster, but they're still not part of the vaccine passport system. So I'd like to get your thinking, please, on why they aren't in, and do you ever see boosters being part of the vaccine passport system?
Well, thank you for that, Robert. That would be a government decision, and we would give them options on how to include a third dose into the passport system. We have not reviewed that as an option for government as of yet, and are waiting nationally to hear the direction of the federal government, as well as whether other governments across Ontario or across Canada are moving in that direction. So it's clearly an open policy window at present.
Follow up.
All right, thank you. And I noticed this week the YMCA in the Toronto area put out a notice telling its members that when gyms resume or reopen on Monday, the YMCA will require masking at all times, even when people are exercising. So what is your recommendation on that? I don't think in the document we got already, if there is something in there about people in gyms wearing masks at all times, I missed it. So what's your thinking on whether people should wear masks in a gym? I noticed a lot of gyms, for example, between the cardio equipment, have a plexiglass shield. And with this being an airborne virus, some people question how much good that actually does.
Well, that's a really good question. So any independent gym or business is able to put in additional measures as they see fit. We do see the benefit of multiple layers. So having screening for any symptoms of COVID-19 before entry, good hand hygiene, good distancing, good ventilation in the building itself, managing your filtration system, your HVAC system, all of those can help reduce the risk. The addition of masking is beneficial. We've got plenty of science, I believe, now to support masking, although I can understand in certain elements of exercise it may be difficult to maintain masking, but I would support a policy that includes a multi-layered approach to protecting individuals in that environment, including masking.
Next question.
Your next question comes from Cynthia Mulligan with City News. Please go ahead.
Hi, Dr. Moore. Earlier, in response to Matthew Bingley's question, you were suggesting that people need to monitor themselves. He was asking when it came to contact tracing being eliminated in restaurants, for example. I guess what I'm trying to get at is your overall message that we all just have to monitor ourselves now and know that if we go to a restaurant or a sporting event or a movie theater, that there is a strong possibility that COVID is around us and that we just have to watch ourselves and take that risk.
I think you're wording it well. I think we have to understand with Omicron that we can't eliminate this threat, that in fact we have to learn to live with it, that we're trying to reduce our risk, but we cannot eliminate the risk in every aspect of our lives. And we have to have a balanced approach as a society against this threat. The ways we reduce the threats have worked well over the last 2 years of masking and distancing and hand hygiene and staying home if you're sick. As well, we now have the benefit of very good vaccines. 2 is good, 3 is certainly better, and encourage anyone to get their 3rd dose who is eligible, 84 days after their last dose. But you're absolutely right. We have to learn as a society to live with this virus, to live with the risk wherever we're going in our community, and adhere to all the best practices. And as a government, we're opening up in a very cautious and slow manner to try to protect our communities as well, and the health system. We've been slow and steady and cautious in Ontario, and that has always done us well. And individuals should have that same approach. Adhere to all the best practices, do a risk assessment when you go out, and ensure that you feel comfortable where you're going, into what venue, but adhere to all the best practices you can to reduce your personal risk and the risk of those around you.
Follow up.
Thank you. Thank you. So if you're going to a stadium, and I know it's capped at 500 or 50% capacity, now snacks will be served and drinks. And we know from pre-holidays that a lot of people were enjoying a hockey game or wherever they were, and they weren't masked. So if you go to one of those situations, are you basically really exposing yourself? And you know, what happens if masks aren't being worn in these locations? What are the odds that you'll get it?
So really good question, and I'm happy to provide a little clarity. You must be masked in all of these venues. You'd be masked when you pick up your food, let's say at a cinema or theater, and once you sit down in your designated seat, that's when you can take off your mask and enjoy the food that you've purchased. We don't want you walking around without a mask and potentially having an increased risk. So the compromise was that you can eat or drink when seated, but not to enable you to walk around unmasked. And the basic tenet of maintaining distancing and masking when not eating is always maintained, and screening before you go in to an environment like that. So it is, again, trying to have a balanced approach. We're reducing the risk. We can never eliminate the risk completely. And we all have to have a balanced approach in these venues. We hope in theaters, or if you're watching an OHL game, that you'll be distanced and that you'll enjoy the environment, and that we'll be able to increase the number of people in those environments over time. But we want to do it slowly, cautiously and safely, given that Omicron is still quite active in our communities. Well, it will be a difficult February, but it'll be a better March. And as we head into the spring, I do hope it'll be much less risk in our environments. But I ask everyone to continue to maintain all the precautions that they've taken, and thank the 2 million Ontarians that have come forward to get vaccinated since January 5th to the 26th. They've all heard the call that we need to protect each other and ourselves. And the third dose has a significant bump in protection against severe outcomes. I absolutely encourage everyone, as your individual risk reduction, vaccination, and the third dose is absolutely key.
Next question.
Your next question comes from Brian Lilly with the Toronto Sun. Please go ahead.
Thank you, Dr. Moore. You're talking a lot about people needing to take their own risks, slowly reopening, but a lot of Ontarians might be looking around and saying, we are moving a lot slower than other jurisdictions. And while you and the government, which are not the same, but you're both saying that you're following the science, other jurisdictions such as Britain, Ireland, the Netherlands, Denmark are all reopening much quicker. And they're saying they're following the science. Denmark will move to virtually no restrictions next week. So what is the difference in terms of the science that you're looking at and what they're looking at? Is it just a difference in how things are playing out in Ontario? Is it a different risk tolerance? What is the difference between what we're seeing in other jurisdictions in Europe and what we're seeing here?
Really good question. And certainly we're focused on the Ontario situation. In Ontario, for this particular wave, we've been really concentrating on protecting our health system, protecting the hardworking nurses, physicians, respiratory techs, dietitians, administrators. We know that they're 100% capacity already, and we don't want them to have to be at 110 or 115%. We want to be able to provide care to Ontarians at the right time, at the right place, if they need it. And that has been our focus. Health systems are unique to each country and or province and have certain limitations and capacity limits. And our goal, and thank you Ontarians for all the sacrifices you've made since January 5th, has been simply to protect the healthcare system, not to eliminate the virus. And we think we have plateaued. We think we've reached a crest, after which we hope there'll be a steady decline, and that the sacrifices that we've made have allowed the health system to be able to provide the right care at the right time. I do believe we've achieved that. And now we can slowly and cautiously remove the public health measures so that we don't have a sudden rebound and a negative untoward effect on our health system. So it's really dependent upon each individual health system. In Denmark, they put in a very profound public health measures long before we did, which were, I would say, in a severity index, much more severe and prolonged. We tried to time ours to be as minimal as possible, to be as balanced as possible, and to protect the health system as best we could. And I do think, thanks to all Ontarians, we've been able to achieve that. So great question. We're monitoring what's going on in all of these other jurisdictions. We're monitoring best practices, trying to understand how we can minimize public health measures, because no one wants these in place for, as the Premier would say, a minute longer than they have to be. We're trying to assure that our goals that we set out as a province have worked. I do believe they have, and now it's time to slowly reopen and avoid a rebound in cases and impact on the health system. I trust Ontarians that we can open safely and cautiously, and if we're making quicker progress, rest assured that we'll continue to follow the data and remove public health measures in a responsive means to have us back to as normal as we can be. It's a cautious plan, but it will always respond to data.
Follow up?
So I appreciate the answer, Doctor. And while I might find your plan too cautious, there are a number of people, including doctors, who are saying that you are being far too aggressive in moving forward, and that you're putting everything at risk, that we shouldn't have opened schools without more measures in place, that reopening businesses next week will put all of us at risk, that essentially we need to continue lockdowns. And so there's a lot of people who listen to these doctors who believe that, don't believe what you're saying, that we need to in some ways learn to live with the virus. So how do you convince nervous Ontarians that this is not something that we're going to get to zero before we start moving back to normal life? What do you say to people who are anxious because they're listening to doctors who say any reopening is too much or too soon or puts us or our children at risk?
Yeah, so great question, and it's a discussion I think in our democracy we should have, and I do want us to have a balanced, proportioned, and reasoned and data-driven reopening. And in the face of Omicron, I absolutely think we have to start to understand, we have to learn to live with this virus. And we've let our lives be controlled for the last 2 years in a significant amount of fear. And now we're going to have to change some of that thinking. We've got vaccines that are safe and effective. The third dose is proving to be exceptionally protective, 88 to 95% against severe outcomes. We now have oral antiviral outpatient therapies. Yes, it's 10,800 dose treatments that are available to Ontarians in January, another 10,000 in February, but more will be available. And I do believe further medications and other vaccines may be available to us, like Novavax in the near term. So the pandemic is evolving. We're getting new interventions. We may get even newer vaccines that some of those that were hesitant may want to review. But we have to have a balanced and proportionate response to this virus. And we have to look at the mental, the physical, the social, the economic, and the educational impacts that this virus has had on our children and our businesses, and learn from the last 2 years that sometimes we were too cautious. It'll never be exactly right for everybody, and it's healthy to have debate, but we do have to have a balanced response to this virus and learn to live with it.
Last question.
Your last question comes from Colin DeMello with CTV News. Please go ahead.
Hey, Dr. Moore, just talking about the data that you were mentioning, you've always been a very data-driven person, but over the last number of weeks and months, I mean, you've really started to pare back the PCR testing, rapid testing, COVID information in schools. Now you're removing contact tracing requirements. So all of those tools over the past 2 years were designed to tell us, if there's smoke, there could be fire. How are you going to know now if things are getting worse?
If things are getting worse, we still have a significant amount of PCR testing that's done across Ontario. So 40,000 tests or more on a daily basis. And the percentage of them being positive was averaging for 7 days, 18%, but today it's 14%. That's trending in the right direction. So we still have that as an important surveillance signal. We still have testing for anyone hospitalized in Ontario, and that number today is trending in the right direction, down 371 cases admitted to hospital. The ICU numbers are stable. The number of individuals requiring ventilation, sadly, it's going up a little, but not accelerating rapidly. So all of those metrics are still very good. And then we put that in the face of 2 million additional Ontarians got vaccinated since January 5th. And the additional protection that we have against this virus through improved vaccination coverage at a population level. More and more of our children are getting protected with their first and now their second doses, 5 to 11 years of age. And now for those that are unvaccinated or immunocompromised and get COVID-19, we have outpatient oral antiviral therapy. So to me, this is giving us greater confidence. And Ontarians have stayed relatively united in adhering to all the best practices, masking in public, on buses, on subways, on protecting each other through the basic public health measures, as well as I think 90% of the 12 and up population being vaccinated, I think is brilliant. Together, all of those metrics inform us on a daily basis of where we're heading. And I do believe we're cresting and have reached a peak. So the sacrifices Ontarians have made is working, and that we can now start on the 31st to safely reopen in a balanced, proportionate, safe, and cautious means.
Okay, thank you. And it sounds like from everything you're saying today, the endemic really is on the horizon here. So can you give me what you think you want to see before saying, we can lift the masking requirement, we can lift all of the physical distancing requirements? Do you think that might come before May, as an example?
I'm very, very hopeful, Colin, and thanks for that question. So as we said, we thought January would be tough, and it certainly has been. And my condolences to anyone that's lost a loved one. February, I do hope we're cresting and we'll start to decelerate on the health system impact. I do think March will be a much better month, and certainly by April, we'll be heading to that low rate of activity in the community. It always helps to understand that the weather's going to get better. We will get outdoors more. There will be more sunshine every day. I hope you're hearing hope in my voice. And as we head to that low endemic rate, that's when we review all public health measures that have been put in play. No one wants them a minute longer than they have to be, and they have to be proportionate to the risk. I do see the risk going down less and less day by day, month by month going forward, all the while staying humble in front of this virus, deep humility that I can make these statements, understanding that we have to monitor for any new variant, any change in the protection from the vaccine. And I want to assure Ontarians we've got a great laboratory system and network monitoring for any new variant in Ontario, good whole genome sequencing, and good partnership at a national level with the National Medical Lab and with the WHO to continue to monitor for any other variants that arise that we may need to change our strategy on. But so far, I am hopeful and anticipating March and April having much lower risk for all Ontarians.
Thanks, everyone.